Niue Full Hospital has released a press statement of Niue's first suspected case of chikungunya and is treating the sudden passing of a young patient yesterday as relating to the chikungunya-like illness. The young patient, who arrived on the flight from Samoa via New Zealand on Saturday, posed symptoms at the border and was hospitalized on Sunday. Niue Full Hospital confirmed that the patient was presented with clinical symptoms of the chikungunya-like illness. However, the hospital cannot confirm the official results of the suspected case until a confirmation is received from New Zealand. Secretary to Government, Mr. Richard Heeper, spoke on behalf of the Government of Niue.
First and foremost, our thoughts and condolences to the family concerned. From that, it is important also to work with the family and also the health department and also the public at large with regards to what has happened. But most importantly now, going forward, is what action's been taken with regards to the suspected case, because unless we have the blood test confirm with the dinky or the other disease, chikungunya, etc., like disease, we do not wish to preempt on the situation. But what is important is for the health and government plus the community at large to take action, mitigating and also preventative of any outbreak of whether it's dinky or the chikungunya like disease. So that is that's happening since this week. Yeah.
So what are some of the mechanisms in place at the moment to give people confidence that everything has been done?
Yesterday, first and foremost, I'm happy to say that the health department has activated all due process with regards to how to handle or what to do with regards to a suspected case. So the treatment applied by the health department was according to approved standards of treatment and also with additional advice received from Samoa, Fiji, Tahiti, etc. to those type of cases. Secondly, the spraying of the homes in the village of Makifu is part of the process of trying to eliminate. And secondly, also, we have met with the team in hospital, with the minister and the director general, the director, and all staff concerned. There was a very important meeting with regards to the processes to be taken with regards to mitigating and prevention. So that's our target at the moment going forward. It's what we need to do together with everyone in order to prevent an outbreak or possible outbreak of the disease once confirmed.
Mr. Heeper said the government will continue to ensure there is strong preventative measures in place to ensure the virus is contained.
This is a whole country situation, and the public also asks to please eradicate, remove areas where mosquitoes can breed. Whilst we have a spraying sector program going, vector control, the public got to do their part also. Part of what we're going to do also is to all the water tanks in every village which have water, we'll try to turn them upside down in order to eliminate all areas that there are mosquitoes. But we come back to the family, we come back to the child. Those are our priority areas at the moment. That is why I've said to the health team, go up, monitor, and don't wait for the family to say, if you show symptoms, then you come in. It's our part also to be there and monitor and actually see. At this point in time, the Cabinet has not banned travel to Samoa. That is up to individuals to do that. I don't believe there is also intention of banning people from those countries coming to Niue. But what we need to do is to be very, very careful. And we expect people, when they come from those places, to declare any symptoms. If they're sick, seek medical attention as quickly as possible.
Chikungunya is a vector similar to dengue with symptoms such as fever, joint pains and rash, and it can only be transmitted by mosquitoes. Anyone who develops these symptoms is strongly urged to visit a Niue Full hospital as soon as possible and seek assistance. Niue Full Hospital has also strongly asked the public to use insect repellent, mosquito coils, and other preventative measures, including the destruction of mosquito breeding areas around homes. Our thoughts and prayers goes out to Ms. Aife Talangi's family. Continuing from the story on the suspected case of chikungunya, the Niue government this morning signed a declaration on notifiable diseases in the wake of the latest suspected case of chikungunya. Secretary to Government, Mr. Richard Hipa, explains the reasons for the urgent declaration.
There is a process, and one of those is the declaration of notifiable diseases. We've had dengue on the list and other diseases, HIV, etc., added to those lists now, added to the list. And these are not diseases that has been present in Niue, but in preparation of these diseases ever getting to Niue. So those include the Ebola virus disease, the Zika virus, and also the chikungunya virus disease. So Cabinet approved these three type diseases to be included in the declaration of notifiable diseases, meaning that people, like I said before, people who will show signs, symptoms of the diseases, they will be detained under the health regulation, and also that the power vested under the regulation under the Director of Health, that can be delegated down to the officers of health working at the airport, etc., to detain people. On the other side of that is the responsibility of anyone coming into the country to declare the symptoms, body pains, fever, and that will assist us in trying to prevent or try to treat the case being, if you have it, then the early the treatment will be good, because the dengue, as we know, the virus, there's no other treatment but to make sure that you drink a lot of water, dehydration, and taking the painkillers, etc. So early detection and early treatment is the recommended approach. So therefore, this declaration and approved by Cabinet is very important.
The declaration is now implemented. The education sector is gearing up for the new academic year with vigour and determination after educators on the island met at Niue High School to discuss the 2015 pathway. There were plenty of encouragement and inspirational support from leaders and presenters for the enthused educators at the meeting, with some reflecting on past practices and future developments. Honourable Minister Pokotoa Sipili echoed the positive sentiments observed by the morning speakers, which consisted of the Director of Education, Mrs. Bertha Tongahai, Director General, Mrs. Gayleen Tasmania, New Zealand High Commissioner, His Excellency Ross Ardern, and Secretary to Government, Mr. Richard Hipa, to encourage all educators and supporters in guaranteeing a robust and determined education environment for all students. Results from previous years from Niue High School acknowledge the hard work and dedication from both teachers and students to achieve great results, with nearly 100% gaining Level 2 in the NCEA curriculum. 50% of students in Year 11 gained Level 1 of NCEA, while 60% in Year 13. All presenters at the first educators meeting placed great emphasis on the importance of continuing education after high school, as results showed only 20% of students gained university entrance. However, an increase in budget support and investments from the Niue and New Zealand governments is hoped to enhance and develop the education sector further in its efforts for better student results and outcomes. All schools on the island will begin the new school year next week, the 2nd of February. Niue and the Cook Islands are the only two countries in the Pacific reported to be on track to achieve all of the Millennium Development Goals by the end of the year, according to the United Nations Development Programme. The UNDP report the rest of the region carry mixed results, with Papua New Guinea being the only country behind on all goals. However, the UNDP's Pacific team leader for poverty reduction, Ahmed Mustafa, says the focus is already shifting to the post-2015 agenda and the 17 new targets called the Sustainable Development Goals. According to Mr. Mustafa, UNDP has more data available and a large body of lessons learned. There are many up-to-date baselines for many targets which were not available in 2000, in which case he says there is a better chance of achieving the Sustainable Development Goals than the program had with the Millennium Development Goals. Mr. Mustafa says on a global scale, Oceania performed best in literacy, equality in enrollment for education and poverty reduction, but has the worst figures in the world for the political participation for women. To end our news bulletin for tonight, an avid fisherman lost his boat just off the shore in the eastern side of the island when he tried to untangle and cut the rope that was caught in his boat's engine propeller. The fisherman travelled out to sea in the early hours in the morning like every other day, but then a rope caught in the propeller of his boat. By the time he had tried to cut the rope from the propeller, it was too late and he jumped overboard. He then tried to swim ashore, but the current was too strong. The Chief of Police, Tony Edward, cautions all fishermen that to go out to sea, to be vigilant and make sure a life jacket is always on board, that someone is always aware of where you are and when you're returning home, or radio to Telecom Niue to also make sure that everything on board is secured and working. The fishermen made it safely to shore before seeking assistance.